Welcome to the Living Well with Carol show, where health and wellness is the goal. Living wellness, purpose bright. Let's make the world shine with our light. With our light.
Hi, and I hope everybody's having a great day. This is Carol with Living Well with Carol, and I have such a special guest for you today. Here on the Living Well with Carol show, we're always talking about faith, stewardship, and living well from the inside out. And so today I have a very special guest. Her name is Dr. Jennifer Andrade. I hope I am saying that correct. And she is an animal chiropractor who focuses specifically on animal chiropractic care. So, welcome, Jen. How are you today?
Thank you for having me. I'm great.
Awesome. Well, I cannot wait to hear your story. I know you started out as a regular chiropractor, chiropractic
Mhm.
DC. What made you decide to go to animals?
So that's a long story, but I will definitely share that. So, a couple of years ago, nothing's linear in life, right? A couple of years ago, I was feeling really burnout. I was uninspired and I wasn't sure what I was supposed to be doing. I had just got through the pandemic and trying to keep a business afloat. And I wasn't sure if I was meant to be a business owner. I was questioning whether chiropractic was the right path for me. So I decided to talk to some friends, and they encouraged me to speak with a life coach because I needed to get more in touch with myself and what I wanted and who I was. And we did some work, and she asked me a really profound question. What did you want to be before the world told you who you should be when you were a
Oh,
little girl? Yeah,
that's a good
that's what, like that.
question.
That's a big question. And like in the moment, I was just like, I wanted to be a veterinarian. Like there was no hesitation. And she's like, okay, let's dig into that. And through our conversation, we discovered I had a love for animals and helping. And I loved chiropractic. I just hadn't found my people. I hadn't found my niche. So I made the decision that animal chiropractic is what I was going to pursue. So shortly after that, I enrolled in an animal chiropractic certification program, and here I am today. There's a lot more to the story, but that's how I got here.
But I love that. No matter what kind of career you have, so many times we do that career because of expectations or it fell in your lap and that's just the direction you ended up going. And then you kind of can feel like you get stuck in something.
Yep.
I know even myself, my first degree is in the medical field. And then my second degree is in teaching education. And although those had times in my life that they were awesome, I just felt like there was something more that God had for me to do. And it sounds very similar to you. We love to do something that inspires us, that we love to do. And it
Yep.
sounds like I love helping people with their health. And it sounds like for you, this has really lit a spark for you. So tell me, how has it been going once you switched over to animal chiropractic care?
It's been going so well. It's everything I could have imagined and better. Like going back to what you said, like having that passion and the spark was the key for me. It's not that I didn't love chiropractic and people, I just never found like the people that you just easily resonate with, that you can work with easily. And it just feels like it's a flow rather than like a, a challenge, right? And once I started getting into the animal chiropractic world, it felt so easy, so clear, so natural. I mean, I could talk to people about their dogs and animals all day, and those are the people that bring me their animals because they love them like family, and I just love it.
That is amazing. So, what training or certification did you have to get to go along with your chiropractic care to be able to work with animals?
Yeah. So they offer an animal chiropractic certification program. I'm trying to remember. I think there's maybe 6 in the country. So I did the one at Parker University in Dallas, which is where I went to chiropractic school. And it's only offered to DCs, so chiropractors or veterinarians, or students of one of those programs. So you have to have a background in being a doctor to be able to do it. And it is a 210-hour course. and
Wow.
over the course of 5 months. So I'd go once a month and do my training and do my testing, and then culminates in the ABCA certification exam, which is the American Veterinary Chiropractic Association exam. So
Wow.
similar to like a board examination at
Yeah.
that kind of level. So that's the requirements to do that. It depends on the state as well. And I think we had a conversation about that earlier. It's very different in Texas or Colorado or Oklahoma, all over the country. It's really different. But that was my journey. And yeah.
That's amazing. So, how do you work alongside veterinarians?
So um, I work as a referral partner with veterinarians and an advocate for animals. I can't do any kind of primary care with animals. So that means if you need vaccinations or medication, or you have concerns about diet or anything like that, that is in the veterinarian's wheelhouse. Where I get to shine is helping them thrive musculoskeletally, looking at them from a chiropractic lens, adjusting, and then I get to make that recommendation or encourage them to go back to their vet for the other care. So I really love that I have this beautiful box that I get to play in, but I also get to involve other professions and they doing what they do best to support these animals.
That is so cool. So, what are signs that a pet may need chiropractic care?
That's a great question, and it's the most common question I get. The first most common sign I would say is behavior change. So because animals can't communicate verbally to us in a way that we understand, unless you can understand what your dog says when it's barking, they communicate through behavior and what they're doing. So a lot of times we'll see an animal, for example, that is normally pretty tolerant and patient, all of a sudden become grumpy and intolerant, or they're avoiding something that they really love to do. I had a patient this week that the dog loves to play ball, and they threw the ball and he was just laying there looking at it like, well,
Oh,
it's because they're hurting, right? And animals are very in tune with their bodies, and they do what they need to do to take care of themselves. So when we pay attention, we can pick up on these signs. And I tell pet owners, you know them best, and you know what is normal behavior, expected behavior for your animal, and what is when something's off. So I encourage people to really lean into that intuition and that feeling that, hey, there's something seems off. Get somebody to take a look at them. And then movement type of things, right? Having a hard time going up and down stairs, getting in and out of the car, limping is another really common thing that I see. And then just supporting animals as they age is another really common reason that people bring them to me. They're just slowing down.
that's awesome. So, I know like you take your dogs to the vet to maintain care.
Mhm.
What about taking your dog to see you to maintain care or just as being proactive?
Yeah, I do get people that bring their animals in proactively as well. It's really for any life stage. They don't have to have a problem. They don't have to be like an agility dog that's competing. It could be your couch potato dog that you just want to keep well and help them maintain optimal movement, nervous system function, and wellness. So it really can be the spectrum. And I love to get wellness patients in because they're not in pain, they're not struggling, but we just get to help them thrive and have them be vital in their lives.
I love that. And, just like I know as far as humans going and getting a chiropractic visit, it can really open up the body, allow nerves and everything to function correctly, do what they're supposed to do. It can help with lymphatics, it can help with migraines. I mean, there's
Mhm.
just an ongoing list that chiropractic care can do for humans. So I could only imagine the same for animals, just
Yep.
helping guide them to a better way of life. And I bet a lot of people don't realize that something like this is available to their pet. Because
Yeah.
I mean, I have actually taken my pet to a human chiropractor who would work with animals a little on the side, but I've
Yeah.
never met someone like you who you are strictly animals only. Because I do know there's a difference in the way you would adjust an animal versus a human.
Absolutely. Right. And that's why that certification is really important. So understanding the difference in the anatomy and the physiology of the animal, and also just understanding behavior, body language, and just how they communicate, right? Like I can ask you as a human patient, like, what's going on? What makes this better? What makes this worse? What are you struggling with? I can't ask an animal. So it takes specialized training if you don't know what to look for to be able to do that effectively and safely.
That is, I just love that. I think that that's just so amazing. So, how often should animals be evaluated? Is this just a personal preference if I wanted to be a little more proactive, or if I see them, grumpy like you were talking about, or limping or anything, bring them in for those things as well?
So you can go both ways, right? Like, absolutely, if you're seeing a problem, take them to somebody, whether it's an animal chiropractor, your vet, take them to see somebody to get them evaluated, and then they'll get you to the right person. But you can definitely bring them in just for that wellness, like we talked about. And that really looks different from animal to animal. I'd say your average dog, which is the majority of my practice, I'd say every 6 to 8 weeks, if they're not having problems, is a good amount of time for them to get checked. Now, if we're talking about a horse that isn't really active during the winter time, it might be, once a quarter. It's really dependent upon the animal and their situation and what the pet parent is looking for.
So when someone brings you mostly work with dogs, is that
We do.
correct?
Mhm.
So when someone brings their animal in, what does it look like? What kind of walk me through what you do to assess the animal and everything?
Yeah, so everything always starts with the conversation, and I find that that's really important. Is I get acquainted with the dog, I give them some pets and loves. I let them kind of sniff around and get settled in the space while I talk to the pet parent about what's going on, what their medical history is, what we're looking to achieve by getting chiropractic care, and any concerns that they might have. So we go through all of that as the dog's kind of getting the lay of the land, if you will. And then we go into an examination. And that can look very different from dog to dog. Some are really calm and cooperative, and they'll just let me examine them. So I'm looking at how their joints are moving and feel for, inflammation and tightness in their muscles, how they're reacting to different things. I do a brief neurological assessment to see how their nervous system is working, because that's a big piece that we're looking at as chiropractors. And then if the pet parent and myself decide that this is the route we want to go, we discuss what I found and what I think we can achieve, then we go ahead and adjust them. And the adjusting piece is the part that I've always really interested in. And what does that look like? We don't have a table for dogs, right? I'm not gonna have a dog get up on a table and lay down. I've had people actually ask me that, and
No
that's
adjustment
not how it
table.
happens. No adjusting table. I'm most comfortable working on the floor with them. I think sometimes they get a little uncomfortable getting up on some sort of thing because it reminds them of the vet, right? A lot of times the
Right.
vet will examine them on a table and they don't love that. So I adjust them on the floor. Most of the time they're standing. Sometimes they're sitting down or laying. Really, you just have to be adaptable when it comes to working with animals, and you make things work for what they're comfortable with and what they're giving you. And most dogs, you'll see them relax instantly after an adjustment. It's
That's
really,
what I was
really
gonna
cool to
ask you
see.
about.
Yeah.
Yeah, what are some things that you've noticed that as an animal is being adjusted, there are different responses to it?
Yeah. So this is something I talk to pet parents about before we get started so they know what to expect. So in animals, we're looking for what we call nervous system release signs. So signs that they're parasympathetic, or what a lot of people know as their rest and digest system. So where healing happens, we're seeing signs from that. So in dogs, that can look like a shakeout. So that nose to tail shake, you'll see licking, chewing, eye softening, kind of lowering of the head, and then body language that shows that they're comfortable. So
That's
if they
awesome.
lay down, if they have like relaxed tone to their body, those are all signs that we're stimulating that system. And that's really what we look for. We often don't get an audible release with animals in adjustments. Sometimes we do, but it's not as common as it is with humans. So we're looking for those nervous system signs.
I know that when I was using a chiropractor for my dog, we had one before this little one that's over here resting
Mhm.
on her bed. We had a bulldog, or a, what do you call, gosh, boxer. We had a boxer, and she had cancer, and she lived to be 7, and she had cancer, and she was so uncomfortable. So we used chiropractic care just to support her.
Yeah.
And it was very visible when once she was adjusted, or how she would behave, even to the
Mhm.
point she would almost get playful.
Yeah.
And, she would do the shake, and then she would just, like, get playful. It was just really
Mhm.
interesting, how, so you could tell that just really made a huge difference in how she was feeling.
Yep. Yeah, and we see them kind of go back to activities that they might have been avoiding sometimes. A lot of times they sleep, which isn't a bad thing. That's when the healing happens. And dogs or animals in general are really in tune with their bodies. They do what their body needs, right? Like I wish when I had human patients, if I asked them to go home and rest, don't, go back to work afterwards. Obviously, that's not always possible in a human world, but dogs, they listen, right? They go and take a nap when they need a nap.
Yeah.
And their body does what it's intended to do. They listen to their body because their body knows.
I think that's so interesting. What is the most common misconception about animal chiropractic?
I'd say that the most common misconception is people don't understand how educated we are, that we're uneducated, that we're out here, not knowing what we do. If somebody's certified, they go through a rigorous program and testing to make sure that they do know when it's appropriate and when it's not, and when we need to include somebody else. Right, being very clear on what is within our scope and what is not. So being able to work alongside the vets is important.
Well, it sounds like from what you've said that chiropractic care can really help your aging pets be mobile longer,
Mhm.
and and it can improve mobility, behavior, overall vitality. What about athletic or working dogs or animals, horses, whatever the case may be?
Yes, just like humans can see chiropractors to improve performance. I mean, every professional sports team, Olympians, they all use chiropractic care to improve their performance. You can do the same thing for animals as well. And that can be a big part of a practice is, agility dogs, search and rescue dogs, dogs that are doing like dock diving. There's all kinds of dog sports if you don't know. It opened my eyes once I got into this program, the breadth of the different things that are out there. And then for horses as well. I think horses, people think about it more because they're used to horses having a job or competing. But it can be really helpful in reconnecting them with their bodies so that they're moving with better ease. They have better coordination and they're feeling better, so they're going to perform better.
That is awesome. So, what are the most common issues you see in animals?
So some of them we addressed, obviously some sort of musculoskeletal pain, right? And a lot of times we're finding that out from behavior. Limping or lameness that we're not really sure where it came from. Maybe we had evaluation from the vet. We've tried some things and not really gotten anywhere. Just slowing down and just changes that we see with aging pets. Um, and then people just wanting to help improve performance. Even if it's not necessarily a working dog, but a dog that wants to go play ball and isn't able to. So helping them to get back to the activities that they love.
Okay. So we kind of touched on it a little bit, but what are some of the main things pet owners should pay closer attention to even understand if chiropractic care for their animal might be great? I mean, I'm hearing you say the way they behave,
Mhm.
the way they're moving, anything
Yep.
else that would spark them to kind of go, maybe this would really benefit my animal.
Yeah, so a common thing I get is so say you go to touch your dog's back and you get like a kind of a skin crawling or a twitching. That is actually it can be a pain response for them. So that's a reflex that they have in the muscles in their back, and you shouldn't be able to stimulate that reflex from just petting them. So that's a common one. Or just feeling like your dog's off. right? They just don't seem like themselves. And kind of goes back to behavior, but just even personality wise, right? There's something seems off. Maybe it's because they don't feel good. Maybe it's because something's not moving right.
That's amazing. I love that. So I talk about stewardship all the time, honoring God with what we've been giving.
Mhm.
And so do you see caring for animals as a part of that responsibility?
Absolutely. Right. Like it's a huge responsibility that I take very seriously. And I am so blessed that I get to do that. I believe they are God's creatures. They are noble and kind and they're just amazing. And I think it's our job to protect them. Because sometimes they're, vulnerable and they can't protect themselves. So we have to advocate for them.
That's right. So what are the most favorite breeds of dogs that you've enjoyed working with and seen the most benefit with?
I've
That's a hard
seen all kinds of breeds, right? It's hard to like say that I have a favorite. Like I've seen itty bitties, like little Chiweenies.
one.
I've seen like mastiffs. I just saw like an older Weimaraner. I get the whole spectrum, which I love the variety and all the different personalities. I'd say the most common types of dogs is I get a lot of toy breeds and a lot of large breed dogs that are brought to me, but I've seen everything in between. And just those types of dogs, smaller dogs, and some of the larger dogs just have genetically can have more problems. So I think that's
Okay.
why I see them in my office more often.
What breeds do you see the most often?
I'd say so the flat face breeds. So think like your Frenchies and your Boston Terriers, Pugs, those types. And then kind of larger breed dogs.
Okay.
Think like German Shepherds, Labs, Boxers. And we see those for different reasons. The larger breeds, a lot of times they tend to have hip and low back problems, just because of the weight of their body and sometimes how they're bred. And then some of those smaller breed dogs, especially those flat-faced breeds, which we call brachiocephalic breeds, sometimes they have problems with breathing, they have skeletal abnormalities. Dachshunds is another big one because they have those really long backs and they're so little
Yeah.
and they've got those short little legs and everything in our house is really tall and big for them and they like to jump off of it. So, yeah.
Yeah. Well, I know my little one back here, the last time I had her at the vet, they had made a comment about her back knees going in and out.
Oh,
Um,
yeah,
Nothing that is bad at this point, but over time, that could be hard on her body. So she might be a good
absolutely.
candidate to find someone like you because where are you
Yeah.
located?
I am in Arvada, Colorado, which is a suburb of Denver.
Awesome. Yeah,
Yeah.
I'm in Texas, so it
Yeah.
might be hard to see you, but
Yes.
I've been thinking about taking her back in because my hope is not to need surgery on her little body,
Mhm.
but to be able to get her the right care that can help those knees stay in place.
Yeah, that's a common one for those smaller breeds too. They get like their kneecap can sometimes displace,
Yeah.
and then that can cause problems. So
Now
that's
that's
something that chiropractic can support as well. Just having better alignment and better connection with that brain and body. So we have that nervous system controlling those muscles better. We can sometimes support them to not have that happening as often. Yeah.
that's amazing. If there was one thing that you would like to let all the listeners know about chiropractic care for their animals, what would that be?
I would want them to know that it's safe, it's effective, and it's not just for pain or problems like we discussed before. And it's really my mission right now is to get the word out to people because a lot of people don't know that it's an option for their animals. And I want them to know that it's an option sooner because I see so many animals that are coming when they're older or really have been struggling for so long. And this is the last option they've tried. I want them to know that this is an option sooner so we can have more opportunity to help them heal and to live a longer, happier, more active life.
That's awesome. Well, I am so excited that you've been on with us today. And Dr. Jennifer, I've got a banner up here with a lot of your information. Is there
Mhm.
any other information that you would like to share for your listeners if they wanted to find you, locate you, learn more about your services, especially if they're in the Denver area?
Yeah, so all this information is great. You can contact me in any of those ways. If you're local to the Denver area, my phone number is 720-688-6372. But I do, I communicate and check in on these areas regularly. I post on Facebook and on Instagram as well. So it's a similar handle under Instagram. So, and happy to discuss whether it's a good option for you, even if you're not here. I'd love to connect you with an animal chiropractor in your area.
Oh, we're definitely going to have to talk.
Yes.
It sounds like we need one. Well, if today's conversation reminded you that stewardship starts at home with our health and the health of those we care for, man, this is your knowledge and information to get the care that your animals need, but also what does your body need? Our bodies, our families, our animals, they're all part of what's been entrusted to us. So definitely want to care for them well. And Dr. Jennifer, I'm so grateful that you have showed up and you were on the Living Well with Carol podcast. And it has been so nice chatting with you. And I hope that everybody will come and check you out online and ask any questions if they have any. And, be aware of this opportunity to have better care for their animals as well as themselves.
Yeah, thank you so much for having me. I had a lot of fun.
All right. And until we meet again, everybody, thank you for being on the Living Well with Carol show, and we'll talk to you later.
Success happens in action. We have to be doing